to show now is how to make an activated charcoal poultice. As I've mentioned previously, activated charcoal is pretty messy stuff. So I've donned some protective clothing, tied my hair back, got a hat on, looking all first aid-y except for the black shirt. And here's how it's done. So this is the activated charcoals in this container. I have some water. I have a bowl, a spoon. Any applicator would work. I just need a stirring. Some vet wrap, and some tape. The things that are necessary for this are pretty much most of these things, and scissors. So what you want to do is, the problem is trying to make the right consistency of the activated charcoal when it's wet. So basically you're making an activated charcoal slurry. So it's going to be pretty messy, so I'm going to do it on top of this rag, sterile rag. And I'm going to cut it, because I don't need it this big, so you're going to cut it so it covers the area somewhat. You don't want to have it too big. If the bandage is too big, it just gets sloppy on the person. So in this case, we're going to cut it down to this size. This, by the way, is a cloth bandage. It's not a non-stick bandage, which means it'll absorb some of the activated charcoal, but it'll be fine. It's just cheaper too. So cloth bandage. Now I'm going to take the activated charcoal and make the slurry. So I'm going to put, you see, just it's going to be a guesstimate about how much I use. And that's a little too much. So I'll put a little bit back in here and make a big mess already. Next thing we do is add some water. So I'm just going to add enough water to make it a slurry. Too much water will be too wet. So you just start off with a small amount, and that's going to be just about right. So you're going to use the spoon, and it's basically maybe like somewhere between a paste and a slurry. It's going to be a tiny bit more water than that. This is just too sticky. It's just gonna clump off like that. So I'm going to add a tiny bit more. But this is the point. Most people make a mistake. They add too much water, and then you add more charcoal, and then more water. So you just have to be cautious with the amount of water. It takes very little, as you can see, because activated charcoal will just start absorbing the water. This seems like it's probably going to be about right, and we'll see in a minute. So nothing fancy here, right? This is some kind of bowl. Maybe it's stainless steel. Maybe it's some other alloy, and this is just about right. So what I'm going to do next is I'm going to take the activated charcoal. You can see kind of the consistency here. Okay. And you're going to paste this on here. It could probably be slightly wetter. This will work good. So I'm going to actually add a little bit more water because some of the activated charcoal didn't get wet. And see that? Isn't that beautiful?
Yeah.
It goes with my ensemble. And I'm going to paint it, depending on how big the area is. So the water is just to basically put it in a form that it sticks. I don't need it to absorb water per se, because I want the water, the activated charcoal slurry, to absorb the staff. I don't want it to be too watery. If it was a little watery, more watery than this, would be fine. If it was too dry, it wouldn't work. So that's going to be our activated charcoal. If it was a big area, I might have covered it. You can also, if you have your glove on, by the way, you can just, after you do this, you just wipe it off and use the rest. Right? Just like licking your plate. You can also just, everything here is pretty clean. So you could also, if you have gloves on or just your fingers, you can just smear it down. I just want to point out that I am black. Next, we'll have a demonstration model. We'll have Christian come up here. It could be a little bit wetter. Actually, I'm going to try, I think I can make it a little wetter. I haven't tried it this way before. Get a tiny bit more water on here. Yeah, that works. So Improv City, number 21. So if Christian, let's say, had a staph wound right here. By the way, this is an easy place to treat because it's easy to wrap around the wrist. One of the easiest places on the body. What I would do then is, after I've got this all smoothed out, I would just take it and apply it topically like this. Now, in general, so it looks pretty dirty, but it's clean. I might not have worn gloves at this point. My hands are clean. I've washed them with soap and water. You could put tape and tape this on. It'll hold it well. The problem with tape is that when you pull tape off of a wound, you pull the hairs out of the wound. Excuse me, you pull the hairs out of the skin that's local to the wound. Those little micro lacerations sometimes get infected. I've seen this happen. So if I put tape around or I pull the tape off, when I clean it, those places where the tape was can get infected. So instead, so if you have just tape, you can use tape. But better is to use, once again, something like vet wrap. We're in a color scheme here. This is a little bit old, and so it's tearing, but it'll still work. When you put bandages on people, we'll talk about this with soft tissue injury, you don't want to put it on them and pull because that hurts. What you want to do is you want to release as much as you need initially so that you can wrap it without pulling it on their body. So there's a lot of ways to do this, but we're going to just start from the bottom. Anything that comes in contact with her is contaminated. So one thing I could also do, if I was wearing gloves, this might be contaminated. I could just cut off the pieces I need. But basically, this is going to work just fine. So I'm going to try to keep it pretty tight here when I put this bandage on. And by tight, I mean unwrinkly. Wrinkles just are places where things get held onto. And that's pretty much it. So that'll hold itself. But you could put tape on top of this, because that's not going to pull anything off over there. It's probably just about the right tightness. When we talk about soft tissue injuries, we'll talk about it's important to not put things too tight, because with inflammation, it'll start to push out the bandage, which creates even more pain. So we'll use this cloth tape, because cloth tape sticks good on top of this. And I'm going to estimate, take a piece of tape off, just kind of estimate how much I need. Rip it off. I usually come underneath, because that way you get a better shot at keeping it on. And this is just going to hold this on. It'll probably stay by itself. If it doesn't reach all the way, like I just did here, just add a piece on top of it. You want it has to touch itself to really stick well. And so there we have, there's an activated charcoal poultice modeled by the lovely Christian. If you're buying pizza at the Nines, you can say hello to Christian.
And she'll be wearing her activated charcoal poultice.
But more likely, you're more likely than ordering pizza, you will see Christian studying herbal medicine and then practicing herbal medicine. So that's an activated charcoal poultice. Thanks, Christian. I'm going to wash my hands up.